Welcome back to Midday. Dr. Bob Rishiraj joining us. And of course, for our monthly segment with Dr. Rishiraj, welcome back.
Thank you very much. Thanks for having me again.
Absolutely. Today we're talking about TMJ. So I'm just going to ask you right off the bat, Dr. Rishiraj, how would you explain this? Is it a specific disorder? I mean, what are we talking about when you say TMJ?
So TMJ is a mnemonic for temporomandibular joint. So it's a joint that we have that is very specific to conditions such as pain because of what's happening within the joint. It's a very complex joint because it's a joint, it's the only joint that we have in the body that actually glides up and down. It rotates and it moves side to side. We don't have any joint like that.
Okay.
But the biggest problem is that it's a very small space joint. It's got about 5 cc's of space in it. So treating these joints can be very difficult. And it's surrounded by bone all the way around with a thin fibrocartilage disc inside. So the problem can occur with the bone. It can occur with the disc and sometimes a soft tissue around it.
Right.
So it becomes very complex, and figuring it out usually is straightforward just by doing a good clinical examination.
What would be the symptoms? I mean, would it be chronic pain essentially, and is it specific areas that you would feel that pain?
Yeah, so most people who are having TMJ pain will literally point, pain is here. But if they put a point down below the joint area, it's usually a muscular issue. So it can be a combination. So most people will come in, you know what, I'm having a lot of pain.
Yeah.
My jaw is grinding. It's clicking. I can't open as wide as I could a week ago or a month ago. It locks, right? And they have headaches. Sometimes just radiation of pain and the muscles that are constantly working. So a lot of people that come in will have a bruxing or a grinding habit. So at night, they're grinding.
Yeah.
So the analogy I give everyone is, if you have a 1 pound weight and you start doing curls, okay? Imagine doing curls for 8 hours when you're sleeping. You're just moving.
You know, you would be in pain.
You would be in pain. So the muscles can go into spasm.
Yeah.
And you can have spots that you feel in the muscle itself. But when you have the joint space involved, it's typically because there's arthritic changes. Sometimes it's arthritic changes that are occurring within the bone itself, or the fibrocartilage disc, which is a soft tissue disc, but it's very poorly vascularized.
Okay.
So it doesn't have a lot of blood supply. So it does not remodel very quickly. So sometimes there's perforations in the discs. There's the disc is folded up, as we call it, an accordion syndrome sometimes can occur.
We have some pictures. I just want to put these up just to give people more of a visual, Dr. Rishiraj, here. This is what you're talking about here, right?
So if we look at the joint, if we look at the middle where it says temporal bone, and right below that it says temporomandibular joint. So the joint is actually part of the lower jaw. Which is what causes our mouth to open and close. So it sits in that little round spot. It's called the temporomandibular fossa, glenoid fossa, and it rotates in that and moves in that area. So the muscles that are around the area, those two muscles, the masseter muscle and temporalis muscles, are two muscles that can be involved. We have 4 muscles that allow our joint to function and our joint to move. So these muscles can become tender. But if you look inside where it says disc, that is a disc that is usually the compromising factor in patients who develop temporomandibular disorders. Because the back third of that area where it says nerves is full of nerve tissue. And if the disc slides forward, what ends up happening is the nerves get compressed. And when they get compressed, there's pain.
Yeah, absolutely.
So people will come in and say, you know what? When I open, I hear a click or I feel more pain. And it's because the impingement of the nerves that occurs, that causes the pain. So a lot of these patients basically get managed with very conservative medical management. You know, usually with moist heat, I tell people, that is one of the biggest things, because we don't have enough blood supply. So by heating the area up,
Right.
it allows more blood flow. Massaging the area, taking ibuprofen is usually a good drug if your stomach can handle it. And surgically, not very much is done till later, but they usually have to wear a splint,
Right.
sometimes at night, but and sometimes during the day as well. And that makes a difference. And I'm going to say about 75 to 80% of the people do very well, just conservative medical management. And then if that doesn't help, then sometimes we end up scoping the joint.
Okay.
And it's done to alleviate the pressure in the joint, and it's washed out and medications are put in. And that's also very effective. The only time the joints ever get open now is if there is so much arthritis,
Right.
or there's so much deformation of the disc that you have to do, either remove the disc or do something with the disc. So surgery is really not a very early option. It's usually a very late option.
Okay.
If anything needs to be done.
All right. Well, we're out of time, Dr. Rishiraj, so we'll have to stop you there. But for more information, or you feel that pain, pay attention to it, and you can contact Dr. Rishiraj in those areas there at the bottom of the screen. Thanks again, and
My pleasure.
yes, very important to pay attention to that pain and diagnose it to see if it is TMJ.
Right.
We're back in a moment. We've got Natalie Brown joining us. Stay with us.